Today on Inside Utah Politics, Representative John Curtis. He's in studio to discuss some of the bills he's working on and some of the big issues on the table in the nation's capital. Plus, veterans and supporters protesting outside the Capitol, demanding better benefits for those who have served our country.
Time now for Inside Utah Politics.
Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. This morning we do begin with Representative John Curtis. Representative, great to have you back on the show. It's been a while.
It has been too long.
Good to see you. Thanks for coming in. We appreciate your time. Let's start off with your privacy bill. You and I ran into each other at the Pioneer Day Parade not long ago, and you told me about this bill, and it's pretty fascinating because it really is on the minds of a lot of people. You walk into a store, all of a sudden you walk out, you see ads for that store pop up in your social media feed. It's almost like they're watching us and listening to us. Tell us what your bill's all about.
Well, the worry is it's going to get worse. The 5G network that's being rolled out across the country puts in appliances cameras and microphones so that those can connect with the internet, and there's a lot of good that comes out of that, but you can imagine the problems that could come out of that. Around your home, they have microphones and cameras. So we had a bill passed through committee on a unanimous bipartisan basis the other day. It was a really good bill that simply makes sure that consumer is aware if one of those devices is in something they're buying. And it's a great bill, a lot of support back in Washington for it.
So it makes them aware, and then they could go in and remove it if they want to, or disable it, or
yeah,
how does
so
that
to
work?
me, that's actually that's the next bill we need to do, is to make sure that there is an option. Right now it simply says, beware, buyer beware, don't buy this if that's a problem for you. But I really think we ought to make sure manufacturers are giving people an option if they don't want that. Now, let me be clear, there are a lot of benefits that come from these smart devices, right? For instance, if you want to do your laundry in the middle of the night, it can set it to do that, and it will cost you less electricity. Your bill will be lower. So those are the types of things that why we're putting devices in these things. But there's a lot of mischief that can happen as well.
Where's the line? We don't really want them listening to us and necessarily feeding us based off what they listen to, and it really seems like that's what's happening these days.
Well, and it's like I say, it's going to get a lot worse. This 5G concept is that every device in your home, every toaster, every refrigerator, every microwave is going to have these types of devices in it.
And that bill, you feel good about it getting it to the president's desk?
It was unanimous in committee, Republicans and Democrats. I do. It was an important bill, and we actually did 6 privacy bills that day. Really important work for Congress to deal with these privacy issues.
Suicide prevention, a big issue here in the state of Utah. Unfortunately, we're near the top of the nation when it comes to death by suicide. You're also teaming up on a bipartisan bill for that. Tell us what that would do.
Yeah, so we're all looking for solutions for firearms, particularly related to deaths. You know, 6 out of 10 deaths from a firearm are actually suicide. And we don't talk about that enough. And so I teamed with, actually it's a very liberal member of Congress. It's kind of fun. Pramila Jayapal and I teamed up. This is a bill we already have this law in the state of Utah, which gave me a lot of confidence to say, hey, this is something my state would like. But the short version is that it allows individuals to self-opt out of being able to buy a firearm. It's totally voluntary. It's not imposed on anybody. But if somebody knows that they have the potential to get in a bad place, they can preempt that by saying, don't let me buy a firearm.
And has data shown that people actually do that?
It does. I had a woman come into my office in Washington, D.C., and she almost broke down. She said, this would have saved my mother's life. And now, we're not in large numbers, right? I mean, it's not like thousands and thousands, but it's people, and every single one of these is a life. And the more we perfect this concept, I think the more lives we can save.
Once someone does that, how do they work their way back to
totally voluntary. They put themselves on and they take themselves off.
No questions asked.
No questions asked. So they're in control, but there are people who do realize they can get in a bad place, and this is for them.
And what's the status of that bill?
So it's also working its way through because of its bipartisan nature. Suicide Prevention Week is coming up in September. It's our intent to bring it to a vote in September. And we think we have a high likelihood of getting that through the House.
Okay, a bill recently that went through the House that got a lot of attention was the Respect for Marriage Act.
Yeah.
You and the other 3 members of Utah's delegation all voting in favor of that, which caught some by surprise, not necessarily your yes vote, but some of the others. Talk about why you voted for that bill.
Yeah, I might just mention, and it's hard to, you don't want to speak for your colleagues, but this was an interesting one because we all reached that conclusion without talking to each other. A lot of times we'll talk
I was going to ask you to speak for your colleagues, so I'm glad you're doing it voluntarily.
Yeah. A lot of times, you know, we'll talk and brainstorm a bill, but we all actually all came with that yes in mind. For me, there's two things, and I want to point out, a lot of people didn't understand. The bill actually codifies states' rights, and so what the bill really says is that the law of the state is the law. And that's an important issue for federalism, and that was an important issue for this. But another thing that's really important for me is I don't want the federal government telling people who they can marry and who they can't marry. That's a bad place to be in my mind. And if you look throughout history, there was a time when the federal government would have banned interracial marriages. As a matter of fact, that was actually in this bill. And you know, what if somebody feels like you shouldn't ban, you should ban marriages with different religions and things like that? And it's just not the proper role of government for me, for federal government especially, to be saying this is who you can marry and this is who you can't.
Over time, polling has shown that Utahns have changed their attitudes on same-sex marriage, to be specific. What role do you think that played in all 4 members voting yes?
You know, I'm sure it influenced it, and like I say, we all got there in slightly different ways. And I think I've probably changed, if I'm honest, over my lifetime and my feelings about this. But bottom line is, no, I don't want the federal government to tell me who I can marry.
Okay. Another big bill that was quite controversial on the Hill was the contraception vote.
Yeah.
Reverse of the marriage vote, all 4 of our delegation voted against that. Yeah. You have told me you're not against access to contraception, but you didn't like the way this bill did it. Talk to me specifically about why.
Yeah, there are 2 flaws in the bill. And let me just reemphasize, I believe every woman and even man should have access to contraceptives. That's not a question in my mind at all. But this bill went further than that, and it got into these medications that can terminate a pregnancy months after conception. So it really became an abortion bill, and that was very problematic for me. It also, one of the things it did is it mandated that regardless of your religious beliefs, if you're a doctor, you must prescribe contraceptives if asked. So particularly in the Catholic religion, this is a big deal. All contraceptive in the Catholic religion is a big deal, and a Catholic doctor could be mandated to have to prescribe this, and that was a problem for me too. And if they had brought, I guarantee you, if they had brought a clean contraceptive bill up, meaning it's just simply dealing with contraceptives, I can't imagine that wouldn't have been unanimous in the House on all sides. You always get 1 or 2, right, that's not there. But this bill, if you looked a little deeper, and I will tell you, it was not easy. There was great consultation in my office with the women in my office and people back in the district to get to the point where we knew how we were going to vote on that.
I'd like to get your thoughts on how both of those bills are going to do in the Senate. Do you see both of them coming through?
They're dead, right? These were very, very symbolic bills. Speaker Pelosi knew that. Everybody knew that. It goes back to Clarence Thomas's statement about what the Supreme Court may or may not do. And so I'll be shocked if they get a vote in the Senate. They've come and gone.
Even on the marriage bill?
Even on the marriage bill, yeah. I just don't see a vote there.
Okay, we'll see what happens. We have about 30 seconds left, not a lot of time, but you're big on the climate caucus. Republicans unveiling their principles. What are the top things you were pushing for there?
Look, I think it's important, if we only have a few seconds, for people to know we can have energy independence, we can have affordable, reliable prices, we can have a strong economy, and we can reduce emissions. That's something conservatives can get behind, and that's what we're pushing.
All right. There's actually going to be a forum next month with you and some other candidates for election, and I'll be moderating that, so I will see you then,
we go into more detail.
If not before then.
Good.
All right.
Excellent.
Thanks so much. Great to have you. Appreciate it. Still to come on Inside Utah Politics, the Department of Justice suing a neighboring state over its new abortion law that went into effect after the Supreme Court's move to overturn Roe v. Wade. Our panel weighs on that a little later. But first, with their sights set on taking back the House, Republican lawmakers rolling out a new health care bill. We hear from both sides after the break. A bill that would provide health care and disability benefits for millions of veterans exposed to toxic burn pits, winning final approval in the Senate late Tuesday, ending a brief stalemate over the measure that had infuriated advocates and inspired some to camp outside of the Capitol. Washington correspondent Anna Warnicki has the latest.
Veterans and advocates have been camping out outside the steps of the Capitol for about a week, protesting for the Senate to pass this bill. And after some back and forth between lawmakers, the bill finally cleared the upper chamber late Tuesday. Senators joined veterans outside the Capitol late Tuesday to celebrate the passage of the Honoring Our Pact Act.
To our veterans who have been exposed to toxic chemicals from burn pits, we have your back. Finally.
Moments earlier, the Senate passed the bill 86-11, expanding life-saving health care benefits for veterans exposed to the toxic fumes of burn pits.
No more, no more will veterans go to VA hospitals and be told, get a lawyer, go find some arcane, ridiculous proof before we'll give you help.
The $280 billion package would no longer force veterans to prove that their illness was caused by toxic exposures suffered in the military in order to get VA coverage. The House passed the bill in July, but it stalled in the Senate after several Republicans, including Pennsylvania's Senator Pat Toomey, demanded an amendment be added to ensure that the money in the package couldn't be spent on unrelated programs.
What I'm trying to limit is the extent to which they can use a budgetary gimmick to reclassify spending so that they can go on an unrelated spending binge.
Senator Toomey voted against the final bill, but Democrats were still able to secure enough Republican votes to push it through.
They deserve access to care as quickly as they can possibly get it.
This is a day to celebrate because it's a day that Congress actually worked.
The bill now heads to the president's desk, where President Biden says he already plans to sign it. For now, in Washington, I'm Anna Warnicki. Back to you.
Midterm elections are now less than 100 days away, and Republicans are gearing up for a potential takeback of the House. An Arkansas congressman just reintroduced his health care bill that would increase the number of insured Americans and lower costs. But Democrats are still working on their own policies, arguing their loss is not a foregone conclusion. Washington correspondent Jesse Tenor reports.
There's so many problems in healthcare.
But Arkansas Republican Congressman Bruce Westerman says he has a solution.
How do we really address healthcare? And you're going to have to do something bipartisan.
Westerman combined both Republican and Democratic provisions into a bill that aims to lower healthcare costs and cover more people.
It's just a compilation of really good policy ideas.
Still, Westerman says it's unlikely the entire plan moves through Congress all at once, but he hopes portions, like expanding telehealth services, make progress.
It falls right in with the Republicans' commitment to America.
Even though Westerman is trying to take a bipartisan approach, his bill is part of the GOP playbook heading into November's midterm elections.
We want to put the country back on the right track.
House Republican leader Kevin McCarthy could be Speaker next year, but Nancy Pelosi isn't giving up control of the House without a fight.
Make no mistake, I've said to you, we have every intention of winning this election.
Democrats also want to deliver on their health care promises by passing the Inflation Reduction Act. It would lower health insurance premiums for millions insured under the Affordable Care Act and cut the cost of many prescriptions.
Historic. First time HHS secretary can negotiate for lower prescription drug prices.
The Senate will likely send the legislation to the House this week on a party line vote. In Washington, I'm Jesse Tenor.
Coming up, congressional Democrats are poised to pass a $260 billion spending plan they say will reduce inflation. Our panel weighs in after the break.
Watching Inside Utah Politics.
Time now for a closer look at some of the big stories of the week with the Inside Utah Politics panel. This week we have State Representative Carol Spackman-Moss and State Senator Todd Weiler. Great to have both of you here. Thanks so much for joining us.
Good morning, Glenn.
Morning.
Let's get right into the Department of Justice filing that lawsuit against Idaho's abortion law. the AG really taking issue with the idea that a provider doing an abortion as applied to women suffering medical emergencies, that's what he says he's making his case around. Representative, let's start with you. Your take on this play from the administration.
Well, that law in Idaho, the trigger law, is clearly violating the federal law because the federal law requires in a medical emergency, anyone going to a hospital, they must be stabilized and treated. So if a woman comes in and she's bleeding from a miscarriage or even a botched abortion, it doesn't matter, but mostly miscarriage, a doctor might be at risk of a felony charge if he treats her. And that's just draconian, not to mention the fact that it violates the supremacy clause because federal law supersedes state law. So that is a huge problem for women, and it could result in deaths or serious injury to a lot of women.
Senator, your assessment on this move by the DOJ?
Well, the federal law is tied to Medicaid funding, so it only applies if the hospital accepts Medicaid funding, which is, quite frankly, probably almost every hospital in the country. But you know, I think that the lawsuit has a point, and I want your viewers to understand, Glenn. Idaho's law is a lot stricter than Utah's law, and so we have had this law in place for years that if you go to an emergency room, you can't be turned away with a life-threatening situation. But I want to put this in perspective. Less than 1% of the abortions in this country affect the health of the mother. And so, you know, we're kind of dancing around the periphery here. Over 99% of the abortions in this country don't affect the health of the mother. Many of them are, you know, it's an option for someone who didn't use birth control, or as a plan B, if you will, or plan C. But in any event, I do agree with Representative Spackman that the life of the mothers should be preserved. And, you know, I think that Idaho is going to probably have to take a look and make sure that their law clarifies that allows doctors to do that.
There's a lot of argument, even though with our state law, which, as you point out correctly, Senator, is different than what we're talking about in Idaho. But there's a lot of argument still that it's vague what that means, what the definition is. Representative, your thoughts on that?
Well, our trigger law in Utah, it really is flawed. And for one thing, that it requires 2 doctors to concur that the fetus isn't viable, or, you know, if a woman, again, is hemorrhaging and is having a miscarriage and someone thinks it maybe isn't legitimate, it would require 2 doctors. One of our legislators, Representative Lesser, who was an OBGYN for 35 years, says at 3 in the morning, when a mother is bleeding seriously, you can't call 2 doctors to come in and verify. I mean, that's one huge problem, but there are others too that are vague about that trigger law, and they really need to be addressed.
Senator, your thoughts on that? Do we need to take a look at this trigger law and make some adjustments to it?
Well, I'm sure that there will be adjustments to the trigger law, and we want to get the policy right. But let's be clear. I mean, we're talking about ending the life of an unborn child, and so we don't want one doctor who may be a pro-abortion advocate. And we have several doctors that fit that description in Salt Lake City, and I've talked to many of them. They are clearly cheerleaders for abortion, and that's their constitutional right under free speech. But all this law is saying is you need to have 2 people agree that the mother's you know, life is in question. And I think Representative Spackman and Representative Lesser have raised valid points, and I think the legislature should be looking at making sure those details are the right policy.
Let's dig into the dynamic of what we're seeing play out here. We had this ruling by the Supreme Court. Now we have the Department of Justice responding. Is this a power struggle that we're starting to see, and will there be more lawsuits to follow? Representative.
Well, look what happened in Kansas last night. I think people are saying this has gone way too far, and we're talking about women's rights, and it relates to health care and reproductive justice. And I think that was a big signal. And I think in Idaho, the same thing, the Department of Justice saying, this is so draconian, so strict and severe, we need to address this. And the other thing about Utah's and other states, when they're talking about rape, requiring them to report to law enforcement before they could perform an abortion when less than 10% of all rapes are even reported, that's another area that really has to be looked at, because incest, another one. I mean, when that 10-year-old girl was pregnant and had to go to another state for an abortion, and then the doctor might be charged with a criminal penalty, that's just inhumane. We really need to address those aspects of any of these trigger laws.
Senator, your thoughts on this dynamic we're seeing play out between DOJ and the Supreme Court?
Well, I think that there are people who are really, really, really pro-abortion, and they're going to continue to, nip at the edges and try to prevent states from, like Utah, from outlawing abortions unless the health of the mother is at risk, or the pregnancy results from rape or incest. I support those exceptions. We might have some people try to close those exceptions, and I would vote against those. But quite frankly, if that 10-year-old girl who was raped by her mother's boyfriend, who was an illegal immigrant, and the media didn't want to report that for a while, if that girl had been in Utah, she wouldn't have had to leave the state. And there's many arguments that she didn't really have to leave her home state. Fortunately, she did get the medical care she was seeking in Indiana.
So does that bring up an issue then with this patchwork of law across the country that's potentially problematic, where depending on the state you live in, the rules are completely different? Representative.
It absolutely does. I mean, look at the maps right now. When I look at those maps and see the states where they could go and how far they are from some states that ban abortions altogether and have no exceptions, it's going to be a disaster. I mean, women will suffer, women will die, who have legitimate reasons for having an abortion, not just, oh, I didn't use birth control, I forgot. And then there's going to be an increase in the use of the abortion pills, and sometimes those result in problems that they have to seek medical care. So I think we're just going to see this play out in ways that are dangerous and life-threatening to many women.
Your thoughts on that, Senator? A situation where a woman living, say, in Grand County, Utah, has different rules than an hour away in Mesa County, Colorado.
Well, we have 50 states. The states create the federal government. All of the rights that weren't given to the federal government were preserved for the states. This is everything that a fourth grader should know about the founding of our country. And yeah, we're going to have sometimes different laws in different states. You can buy a Powerball ticket in Idaho and you can't in Utah. This is not unfamiliar, but let's be honest. If you lived in St. George or Cedar City, it was always closer to go to Las Vegas for an abortion than it was for Salt Lake. Same with Green River versus Colorado versus Utah. And so for people outside of the Wasatch Front, they're used to traveling to other states because Utah is such a big state. But I don't think that there's anything inherent. The people of Utah don't want the legislatures of California and New York setting our laws. And I think that Utah, the trigger law, I think the majority of Utahns do support that, and I think it should also, maybe be tweaked if circumstances warrant.
Okay, we have about a minute left, but I want to get into one other quick topic real fast: the Inflation Reduction Act. According to a Congressional Joint Committee on Taxation, it will spend $260 billion over the next 10 years and raise taxes $326 billion over that same time period. Representative, is that the way to get out of inflation?
Well, I think those numbers can be disputed, but some of the basic tenets are this. It will reduce the cost of prescription drugs because Medicare can negotiate directly with pharmaceutical companies. It will reduce the cost of health care because the ACA will be extended. It will make, it will cap out of pocket costs for seniors. This is really going to help seniors and middle and low income folks. It also has a carbon emissions part that will help the climate. But here's a key part. With better tax regulations, we'll have more demand, fairer taxes, with money that will go into increasing manufacturing and start manufacturing batteries and chips and things from others that other countries have. That's going to bring back manufacturing and increase jobs and wages. So
okay, we've run out of time real quick. I need to give the Senator just a few seconds to respond. Senator
Number one, there's no effect on inflation until 2027. Number two, it's like bringing a squirt gun to a house engulfed in flames. That's what Nancy Pelosi and Chuck Schumer, they're bringing us, if your house is on fire, they show up with a squirt gun and say, we're going to help put it out.
All right,
That's
on
what
that
this
note,
bill is.
on that note, we'll have to end it there. Really insightful conversation. I appreciate having you both here. Thanks for being with us. Stay with us. We'll be right back after the break with more Inside Utah Politics. We leave you now with a look at what's on the radar in the world of politics. Congress now on summer recess, the Senate returning Tuesday, September 6th, the House a week later on Tuesday, September 13th. The general election is set for Tuesday, November 8th. Make sure to connect with me on social media. I'd like to know what you think of this show and other issues that are important to you. You can email me at InsideUtahPolitics@abc4.com. You can also follow me on Twitter, Facebook, and Instagram. Thanks so much for making us part of your Sunday morning. We hope to see you again next week as we go inside Utah Politics.